Common Ground, creating equity through public policy and community engagement.
Hello and welcome to this edition of Common Ground. I'm Lynn Vaughn, your host. Now, on May 1st, 2012, Fulton County launched an unprecedented assault on asthma. In May, we mark Asthma Awareness Month, Air Quality Awareness Week, and World Asthma Day. The Fulton initiative is called FAIR, which stands for Fulton Asthma Improvement and Reduction. The county pulled together dozens of organizations and groups that have been working on the growing asthma problem individually. Now, under the FAIR initiative, they will work collaboratively. And if you think controlling asthma is just a matter of taking a few puffs on an inhaler, you are wrong. According to the Centers for Disease Control and Prevention, 9 people in America die from asthma each day. At the summit, 2 Fulton County families shared the grief of losing their children. Sarah and Tim Passons of Alpharetta relived the horrible day in October of 2011 when their 11-year-old daughter, Brennan Nicole, suffered a fatal asthma attack. Their pain was evident as they barely spoke above a whisper.
Distress. She was wheezing. She was laboring for air, and she was scared.
Both of the Passons' children suffered from asthma, and neither had had an attack severe enough to send them to the hospital. When Brennan fell ill after eating takeout pizza from a restaurant her family frequented, her mom wasn't unduly alarmed.
I was just about to go upstairs myself, and I heard her yell out for help, and I wasn't quite sure I heard what I thought I heard, but she said, "Mommy, I can't breathe." And when I went around the corner to the stairs, she was sitting on the top landing, laboring and wheezing when she was inhaling and exhaling, and I knew something was wrong, and it had never happened before.
When it became clear Brennan was in distress, Mrs. Passons began driving to the hospital.
I asked her if she felt like she was going to faint, and she said, "Yes, Mommy," and she closed her eyes and put her head back. Mm-hmm. And so I knew there was a fire station about 800 feet away to the right. So I took a right and pulled into the fire station, thinking that, they will be there, they're paramedics, they'll have an ambulance, they'll know what to do.
I was on a plane, and when I landed in Miami, I got a text from my son saying that they were headed to the hospital, that Brennan couldn't breathe. Mm-hmm. And I kept trying to call. I couldn't get through to them, and finally I got through, and Sarah was in hysterics. At that point, she was being driven to the hospital by a police officer, and I got on the same plane I just got off of and flew back to Atlanta, not knowing what was going on.
At the hospital, Sarah Passons dared to hope Brennan was just fine.
So I'm thinking she's okay this whole time, that okay, she's intubated and she must have had a reaction to something and he's going to tell me what happened. And I walked into a full code, full-on CPR, and he didn't know. No, nobody, to this day, I do not know what triggered the asthma attack. And they called the code after it was a little under an hour, and she didn't make it.
By the time I landed, I got a text from a friend saying she was picking me up from the airport. So I was on a plane realizing that my daughter didn't make it.
The Passons had no idea their daughter's condition could take her life.
Nobody had ever sat down with us and said, worst case scenario, if your child goes into full-blown asthma attack and is in respiratory distress, this is what you do. This is how many nebulizer treatments you can give them back to back while you're calling 911 waiting for help, or here's an epinephrine pen, this is when it's appropriate to use one. Now those were some first-line drugs that I have found out since that is very typical to administer to a child or an adult in respiratory arrest, in full-blown asthma attacks where they have stopped breathing on their own, which she had.
Brennan Passons was 11 years old when she died in October 2011. A decade earlier, on January 11, 2001, Mrs. Rhonda Mitchell lost her son, Kellen Edwin Bolden, to asthma just before his 11th birthday. Mrs. Mitchell understands the Passons' pain. She now devotes her time to educating others about the dangers of asthma.
One asthma death is one too many. On behalf of my son, Kellen Edwin Bolton, who passed away on January 11, 2001, I am here today to be a voice. Asthma is a thief, a deceiver, a disease of 1,000 different faces. When Kellen passed away, it was the worst day of my life. I've learned to live with the death of my son, but I also felt that something more needed to be done so that other children would not suffer like Kellen. Today I'm very grateful that my son's living and death will not be in vain. I believe that more should be done. And I believe that we the people can come together to make a difference for children and adults. Thank you.
Because it's critical that children like Kellen and Brennan have immediate access to medication, Mrs. Mitchell worked with the American Lung Association in Georgia to pass the Kellen Edwin Bolden Act in April of 2002. That law permits children with asthma or severe allergies to carry and administer their own medication at school, subject to the policies established by each school district.
Such horrible tragedies. But now both these moms donate much of their time to educating people about the danger of asthma and working to bring the conditions that lead to asthma under control. When we come back, Fulton County's medical director, Dr. Matthew McKenna, lays out the facts and figures of asthma at the FAIR Summit. Back in a moment. Hi again. Welcome back to Common Ground. In Fulton County, on average, 17 county residents die of asthma each year, and 12% of Fulton County children suffer from asthma. The problem is most acute in districts 5, 6, and 7. As Medical Director Dr. Matthew McKenna explains, the illness leads to more missed school and work days than almost anything else. In Fulton, no place is exempt from asthma and asthma deaths, but both are particularly high in districts 5, 6, and 7. Dr. McKenna explained that the Fulton Asthma Improvement and Reduction Initiative, or FAIR, was in response to the Board of Commissioners' mandate to work to reduce those disparate outcomes.
No place in the county is exempt. There are hospitalizations and deaths from asthma that occur throughout the county. And we all share sort of the same air in the metro area. There are many things we share. There are some things that are more concentrated than others. But there are issues that clearly need to be addressed, that are cost-cutting, that we need to all here in the room to help us with. Now, what can we do? I tend to think of a useful framework for thinking about asthma and what we do about it is a stool with 3 legs. If we're actually going to do what we're calling this initiative, and that's have asthma improvement and reduction, we need to strengthen the legs that allow us to make that happen. The one leg is our outdoor air environment. As we've already heard, the Fulton County and the Atlanta metro area continually gets very low grades from the American Lung Association on this issue. We have high numbers of ozone days. We apparently had some improvement in our particulate days, but we still get an F on ozone. So we have a sort of perfect storm when we combine the air pollution and all that pollen we get and all those other things working on that is healthcare access and quality, no doubt, that's been alluded to, and it's a critical component to making sure that children stay out of the hospital in those emergency rooms that we were talking about. And then another important thing is the indoor home environment, both at schools, any institution people go to, and of course, critically, where they spend most of their time, which is home. Things like secondhand smoke, mold, poor housing construction, are all things that contribute to this. So these are all areas we can begin to attack. And the way we really are being encouraged by a variety of public health professionals to think about attacking this is by addressing policy, systems, and environment. And what I've done here is sort of give you or a couple of examples for each of these three domains we can work with. Policies, anti-idling. The county commission last year passed an anti-idling rule for all county vehicles, particularly in the unincorporated part of the county. There's actually a city ordinance against anti-idling for city vehicles as well. And it's something that we can sort of point out for large diesel vehicles that may be just sitting there polluting the air. Guidelines for school renovations, working on making schools healthier and better places. Systems, what sort of systems can be in place? In the medical system, self-use of meds, instructing children who have asthma and reinforcing those messages, and letting them use their medications. We'll hear about that today. In school, without having to go to the school nurse, to be able to get access to them, is a systems issue that can be put in place. And then one that I just wanted to emphasize again, as was talked about a little bit earlier, is the work Fulton County is doing, particularly with mothers and others in clean air, but also with the Head Start centers throughout the county, to institute what's called an air quality flag program, AQI, Air Quality Index Flag Program, where there are posters and education of professionals in those centers to be able to take kids out of the playgrounds and put them in protected areas or bays when the air quality is very bad. And then finally, the environment, which we talk a lot about, the home environment, and then also a big one is our transportation mix and routing in the county. Cars sitting on the highway not going anywhere contribute, we know, tremendously to the asthma problem.
Now, when we come back, one of the fiercest environmentalists in the country brings her considerable resources and talent to the Fulton County fight against asthma. Back after this. In this segment, I want you to meet one of our community partners. Laura Turner Seidel chairs the Captain Planet Foundation, an environmental organization established by her father, Ted Turner, over 20 years ago. You could say the family was green before it became fashionable. Laura and her many organizations have a seat at the fair round table.
We took what they were doing in Texas with the Air Quality Index flag program and brought it to Georgia, had success in those schools, and now we are partnering with Fulton County, with the Health and Wellness Center, to make sure that we are flying flags related to the ozone and how toxic outdoor air quality is, so that the administrators and the school nurses and the parents, everybody and the children, when they arrive at school that day, because they can know that it's a perfectly clean air day if the flag's green.
Rebecca Hull, Director of Mothers and Others for Clean Air, explains the air quality flag system.
And green indicates that air quality is good that day, and we encourage lots of outdoor physical activity. Yellow means it's moderate. Individuals who are particularly sensitive to air pollution may experience some symptoms in the yellow range. Orange means unhealthy for all sensitive groups, and sensitive groups include children birth to age 18, anyone with respiratory problems such as asthma or a heart condition, and also seniors are in the sensitive category. Red means the air outside is unhealthy for everyone.
And that's where school nurses are key, to make sure that the children are managing their asthma efficiently and effectively, that moms know how to manage it, and that we're limiting unnecessary exposure to both outdoor air pollution and indoor air pollution.
Mothers and Others for Clean Air has worked tirelessly with the medical, academic, and social services communities. Now it's on board with FAIR.
And now we see that Fulton County and the Health and Wellness Department has made a huge commitment with this new FAIR initiative. And that's the only way to get things done.
Another accomplishment has been the organization's work to retrofit school buses.
We've done a lot of work to make sure that we're retrofitting these buses. We've worked with about 13 different school districts around the state, and about 1,000 school buses have been retrofitted, so kids are having clean rides to and from school. It's not an option to take care of children, it is a mandate. And when we know what we know now, then we have to move into action. And we have to work together as a community, and then we can start really seeing change.
Seidel points out that Atlanta is no longer in the top 10 of worst cities for asthma. In 2007, Atlanta was the worst at number 1. So she says we are making progress, but there's much to be done.
Thanks to Laura for that interview. Now I'll have the contact information for FAIR and Fulton County Health Services after a break. Now to join, work with, or get more information about the FAIR initiative, that's Fulton Asthma Improvement and Reduction Initiative, call 404-613-3497. You may also call Fulton County Health Services main number, and that's 404-612-1211. That is this edition of Common Ground. Thank you so much for being with us. I'm Lynn Vaughn. Join us next time right here on Common Ground.